nurse today.
Okay.
How are you feeling?
Not so good.
Not so good?
No.
Can I just check your name band real quick?
Sure.
Can you give me your name and date of birth?
Elena Ruiz, 1/8 of 19XX.
Okay. Do you have any allergies, Elena?
No.
Okay. I'm going to pull up a chair here and chat with you a little bit.
Okay.
The doctor has ordered us to place an NG tube in you because you haven't been able to swallow and you haven't had any nutrition. We need to get you some nutrition so that, you know, your body can heal.
Okay.
So I brought one in to show you. This is Salem Sump. It's a 12 French. This is on the smaller side.
Oh, that's good.
So yeah, we want to do smaller to make it a little more comfortable for you. Okay? And so I just wanted to show this to you, but I'm going to need to place this. So this is a flexible tube, and this is going to go in one of the nostrils of your nose, and it's going to go down the back of your throat and into your stomach.
Oh, that sounds horrible.
No, it is not a comfortable procedure. I want to be honest with you. This is probably going to be pretty uncomfortable on the insertion. But I want you to know that I'm going to work as best I can and do the best job that I can to make sure that this goes as easy as it possibly can. Okay?
Okay.
All right. Do you have any questions about this tube?
How long will it be in?
Well, it's going to be in for a few days at least. Hopefully, in the meantime, speech therapy will be able to work with you. Maybe we'll see some improvements on your swallow. Once they say that you're clear for some type of diet, then, you know, we can take it out. It's definitely not a permanent tube.
Oh, okay.
This will for sure not stay in long term.
Okay.
If for some reason you did need a permanent solution or something longer than a month, then we might have to look at something like a peg tube placement. Okay, that's a little further down the line. Today we're just talking about a temporary NG tube. Okay. Now when I do insert this, if I could get your help on it, it'll go a little easier.
Okay.
And some of the things you can do to help me with this is as I first begin to insert it, I'm going to have you put your head back. This creates a little more of an open straight line to the back of your throat, and then it allows me to kind of get it in there a little smoother. I will put some good lube on this to make it go in easy. Now once we get it to that point, I'm going to ask you to put your chin to your chest, and this will kind of close off your airway and help that tube find its way down your esophagus, down into your stomach, and prevent it potentially from going into your lungs. Okay?
Oh, okay.
We don't want it there.
No.
All right?
No.
If you have any signs of coughing, it's just going to have a gag. You're going to have a little bit of a gag reflex with this.
Okay.
But if you feel like at any point you cannot tolerate this process, you can just let me know. You can tap the bed. You can say whatever you want, and we will stop and pause until you're a little more comfortable with proceeding.
Okay.
Okay?
Okay.
All right. Do you have any other questions?
I don't think so.
Okay. All right. Knock, knock. Hello, it's me again, and your nurse. All right, we're going to be inserting that NG tube I talked about. We will do our best to keep this simple and as pain-free as possible. Okay. I'm going to raise you up a little bit here to protect my back, and we'll get you positioned properly for the insertion of this tube. While we're here, let me check your armband. Okay, can you tell me your name and date of birth? All right, that is who you said you were last time. We're good. And I'm going to raise the head of your bed to have you in as close to a sitting position as I can get you here. So I have my supplies here. So the first thing I want to do is take a look in your mouth and your nose, just to make sure everything looks okay. Decide which side we're going to be using as far as your nose. And can you say ah for me? All right, good. I'm going to just check your gag here. Okay, that's intact. All right. So now we're going to measure the NG tube, make sure we get it to the most correct spot for you. So I'm going to start with the tip of the NG at the tip of the nose, take it back to the edge of the top of the ear, and then take it down to your what we call xiphoid process, or that little bone that sticks out in your chest. And we got about 62 on the number, so that's going to be our goal for insertion. 62 is the number I'm going to use, so I'm not going to actually mark the tube in any other way. I'm just going to remember the number. All right, so we're going to put a little lubricant on this tube here. This will allow for easier passage. All right, so we're going to use the left nair. All right, and we're going to go in straight back until I feel a little bit of resistance. All right, I'll ask you to put your chin to chest and try to swallow for me as I continue to insert this tube. You're doing great. Good job. Okay, and we got to 62 here. Perfect. Take a little piece of tape here and kind of secure it on your nose for just a moment while I check for placement. So it doesn't slip out of your nose while we're working on that. And the first thing I'm going to do is grab a little bit of your stomach juices and check the pH. So I'm going to pull back a little here. Just about 5 mLs is all I need here. I'm going to put it here in this little cup. I'm going to get my pH strip. Test the secretions. And according to the gauge, it's coming back at about a 3, which is good. That's suggesting that we're in the stomach, because our stomach acids will bring down that pH. So that's a good first test. But we will send you for an abdominal x-ray, and that will verify placement radiologically so that we know that that tube is in your stomach before we use it for anything like your medications or food. So we won't put anything down there until we've done that. But because the stomach acid came back, I will secure this a little better with this securement device. Hook it to the nose. And then around there. All right. In the meantime, we'll lower you to a comfortable position. But we'll keep the head of bed at about 30. We want to start you to get comfortable with that. We want to make sure we're keeping things that are in your stomach. And we do that by keeping the head of bed at about 30 degrees. If you have any questions, your call light is right here on the bed. This little red button will get me in here just like that, and I'll come in and see anything you need. Alrighty? I'll be back in a few after you've had your abdominal x-ray done. We'll see you later. Knock, knock, knock. Hi. It's me again, and your nurse. I'm here to give you your medication. We verified the placement of your NG tube. Remember that abdominal x-ray they came in and did?
Yes.
Well, the radiologist says that the tip of your NG tube is in your stomach, so we are good to use it now.
Okay.
So I'm going to be giving you your propranolol, which is a beta blocker. This will help bring down your blood pressure and lower your heart rate. A couple of the side effects, you know, sometimes it can bring down that blood pressure a little bit too far. You might experience some dizziness, but we also are monitoring your vital signs. We checked your last blood pressure, which was 135/92, so that's perfectly appropriate, and your heart rate was in the 80s. So I feel comfortable giving this to you. Do you have any questions about this medication?
No.
Okay. All right, and I've done my first 2 checks outside the room. I'm going to do my 3rd check here at the bedside. right. Before we get started any further, I just need to re-verify your name band. Can you tell me your name and date of birth?
Elena Ruiz, 1/8/19XX.
Perfect. All right. I'll keep that exposed here because I am going to do my third check on the medication here on the MAR. And I'm going to press the button and scan your band. And then scan the medication. Okay. Propranolol 20 milligram tablets given NG tube route. It is not expired. And do you have any allergies?
No.
Okay. And we're not allergic, and it is the correct time. Doctors ordered it to give now. Alrighty. Okay, so the first thing I'm going to do, I know that the radiologist said it's in the right place. I want to just put a little air in it, clear the tube, and listen for what we call a little stomach gurgle, just to kind of verify again that that tube is still in your stomach. So I'm going to put a couple of cc's of air in here. I'm going to place my stethoscope right here over your stomach area, and I'm just going to press that air in. And I heard a little gurgle there. Perfect. Okay, I'm just going to pull back here. I'm going to see what we got. Okay, I don't see anything in your stomach at this time, so that's good. I'm going to place a Lopez valve on your NG tube now. This will allow me to administer medications through this port, and if the doctor orders any kind of tube feed, we can hook that up to you as well. So this is kind of a handy dandy little attachment we'll use here on your NG tube. All right, so in administering this medication, I'm going to crush this medication first. Make sure it's good and crushed so it goes down that tube nice and smooth. And then I'm going to flush your tube with just a few mLs of water, maybe 5 to 10, just to make sure everything is patent and clear. I'm hooking this to the port here, and my off is towards your tube. Now I'm going to turn the off this way. So now I've created an open line to my patient. I'm just going to flush. Everything looks good. That went in very nicely. Turn the off back to the patient. Okay, so now I'm going to pour a little bit of water into my medicine cup. I'm going to add the med. Make sure you get your money's worth. I'm going to mix the med in here. Pull it up. There's some residual in the cup. I'm going to get this on the rinse, okay? Because I'm going to flush this.
And Ann, don't put that in the bag.
Don't put it in.
Just act like you are.
Okay. All right, I'm going to hook it up to the tube here. Turn my off port here so I create that open line, and then push the med in. So now for my flush, I kind of like to rinse my bag here. I'm going to flush with about 15 mLs of water. Pull that up. Now my med cup's nice and clean. I feel like I'm giving you all the medications. I leave just a couple mLs of air in here, and that way when I put the medication in the tube, that last bit of air clears the port and make sure everything leaves this syringe and gets into my patient. off to this third area, and then I'm going to push this in and flush. So I gave you your medication, and then I flushed your line. So you have now had the medication administered. I'm going to click sign on my MAR. We're going to keep the head of bed at 30 degrees to prevent what we call aspiration. Now that I've put something in your stomach, we want that to stay in your stomach. If we lay you flat, due to the fact that your swallow is impaired, that could potentially come up and then go down into your lungs. We don't want that to happen, so we're going to keep the head of the bed at 30 degrees. But I will lower you. Again, here's your call light. If you need anything, we'll be back shortly to just check your vital signs. Then we gave you the medication. We want to make sure it's acting appropriately for you. And if you have any questions in the meantime, remember you can always hit that call light. All right. Thank you very much, and we'll see you in a little bit. Knock, knock. Hi.
Hi.
It's me, Ann, again, your nurse. I'm here to give you some food.
Oh, okay.
Yeah, through that NG tube. You know, we verified the placement of that tube through that x-ray, that abdominal x-ray that you just had.
Yes.
The radiologist said that it's in the exact right spot, so we're good to feed you now. And I know you haven't had food in a couple days due to your impaired swallow. So hopefully that will help you feel better, and the nutrition will for sure help you with your healing. But real quick, can I just verify your name and date of birth, please?
Elena Ruiz, 1/8/19XX.
Okay, beautiful. Elena, do you have any allergies?
No.
Okay. We're going to be giving you a tube feed. This is kind of like I would say an enhanced protein shake. And we're going to kind of pour it down in through that tube. You won't taste it, but it will give your body the nutrition that it needs to heal. So let's raise the head of your bed. See that the head of your bed is at 30 degrees. I'm going to raise it just a little bit more for the feeding. So here's our tube feed. The doctor's ordered 250 mLs 3 times a day, and since it's lunchtime now, we're going to be giving you your lunch. Real quick, I just want to do a little quick verifying of placement. I know that the radiologist said it's in the right place, but I'm going to just do what we call a little bit of an air bolus, and this just allows me to hear air passing in through that tube and making sure that it's in your stomach. So I'm going to do about 15 cc's of air. Just going to push that air in through the tube. And listen in your epigastric area for that gurgle gurgle. There it is. Wonderful. I'm going to check residual. So I'm going to pull back and see if there's anything in that stomach. I'm feeling some resistance here as I pull back, and nothing is coming up out of that tube. I'm not surprised, as you have not been eating for the last couple days. So I would call that a residual of 0. Okay. So now I'm going to connect my 60 cc syringe to the NG tube. Turn the off port off to this third port, and I'm going to slowly pour your tube feed in. Okay? I want you to let me know if you have any stomach cramping. It's been a few days since you've had food. Sometimes our stomachs shrink a little bit, so if for some reason you get any kind of cramping, I can slow this process down to help make sure that you're comfortable throughout this process. So I'm going to pour a little in here. If I wanted it to go a little faster, I could raise the tube up like this. It will go in a little quicker. If you report any cramping or any discomfort in your stomach, I can lower it and it will go in a little slower. As my tube empties, I will continue to pour in the tube feed until all of it has run in and all of this is empty. And now we are emptied. So I'm going to turn the off port back to the patient. I'm going to give you a little bit of a water flush just to clear that tube. after having given you all your food. Turn the off port back here. We're going to flush a little bit of water in there and clear that tube. There we go. Hopefully that food will help you feel better. Okay, I'll tuck that tube up here under your pillow so it's kind of out of your way. I'm going to keep you sitting in this position for just about 15 minutes, maybe 20 minutes, just to make sure nothing comes up and goes down a wrong tube. But I will lower your bed for your safety. And then after a little while, I'll return the head of your bed back to 30 degrees. All right, if you need anything, your call light's right here. Feel free to press it, reach out to me. If you have any questions or you have any concerns or you're any kind of pain or discomfort. All right, thank you very much. Knock, knock. Hi.
Hi.
It's me, Anne, again, your nurse. I'm here to hook your NG tube up to suction.
Okay.
That abdominal x-ray that they did to verify the placement of your NG tube came back perfect.
Okay.
So the tip of the NG tube is in your stomach. We know it's exactly where it needs to be. But the indication for your NG tube is because of your small bowel obstruction. We want your stomach and your guts to kind of rest a little bit. So we're going to remove everything out of your stomach that will really help you with your nausea and vomiting. So we're going to hook this NG tube up to our suction container and just continually pull out anything that's not able at this time to pass through your bowels.
Okay.
All right. So real quick, if I could just have you verify your name and date of birth.
Elena Ruiz, 1/8 of 19XX.
Okay, perfect. We got the right person. So I had my suction canister set up previously for insertion, just in case you were throwing up or anything. We had our suction ready to go. But now that we're going to hook it up to continuous suction, that's going to look a little different. So I have a connector here, and I'm going to remove my yonker. I'm going to hook the connector into the suction tubing. And we're going to hook that directly into the NG tube itself. So now you're connected to suction here. I'm going to verify that everything is working appropriately. We're going to turn it on. And we're going to turn it to intermittent, which means this is going to go on and then go off. It's not going to be a continuous suction. And this has also been ordered as a low wall suction. So I'm going to change my suction setting here to make sure that it falls in the low section so we're not sucking too hard and potentially causing damage to your stomach. Okay, it's set at low. We are on. You are connected. Everything looks good. Okay, if you have any questions, please feel free to call me on the call light. I'll come in lickety-split to answer any questions or help you with anything that you need. Okay, and I'll be back in a little bit to check on you. All right, we'll see you in a little bit. Knock, knock, knock. Hi.
Hi.
It's me again, Anne, your nurse today. I'm going to be removing that tube.
Oh, good.
Isn't that exciting?
I'm so good.
Yes, you passed your swallow, I heard, and you can eat again. We're going to start you on a puree diet. That's great, great news for you. So this will be a quick procedure, and then you will be free of this tube and be able to eat. So what I'm going to be doing is first I'm going to flush the tube to kind of clear it, and then we're going to just quickly pull it out of your nose, and I'm going to have you hold your breath while we do this. That closes off your airway so nothing drips down where it shouldn't be. Okay? Let me check your name and your date of birth on your ID band.
Elena Ruiz,
Okay.
1/8 19XX.
Beautiful. All right, Elena, let's do this. So I'm going to place this here for you. I'm going to give this to you so that you can wipe your nose and blow your nose after this tube is finally out, okay? All right. I'm noticing the measurement at the nair is correct as documented in the chart, and as I placed this a few days ago, just clear that tube a little bit here. Good. Nice and clear. We're going to remove the adhesive on your nose. Okay. I think we're ready. Are you ready?
Yeah.
All right. So on the count of 3, and then I want you to hold your breath, and I'll count to 3. So ready? Hold your breath. 1, 2, and 3. Good. It's out. Look at that. Tip's intact. Nothing's missing. All done. Here you go. This you can use to blow your nose and wipe your nose. Let me get that for you. I'm going to put your head of bed down just a little bit for you and get you comfortable. You let me know when you're in a good, comfortable position. Okay, beautiful. Again, here's your call light. If you need anything, please feel free to reach out. I'll be just down the hall, but I can get here as fast as you need me. Congratulations on having that removed. I'm so happy for you.